The current medical world uses the term unknown causes unexplained too often and too easily. That is never the attitude of a scientist. This is the limit of current medicine has no other way but to destroy the patient's body by drugs with strong side effects. No, not only the body, but also the mind is not enough to grasp the detailed condition of the whole body and the roots of diseases. It's impossible to find out no matter how dangerous treatment is given. The patient cannot even realize such facts. That's why patients should get. Welcome to this channel. This is the second video of this channel. I'm not an English speaker, so every word I speak will be subtitled like this. So if my pronunciation is not so good, please refer to the subtitles. Then the theme of this time is the fact that should be known before despair. As I mentioned in the first video, my wife has overcome 4 incurable diseases and inoperable cancer, both to the point where she doesn't even need any medication. Systematic lupus erythematosus, thrombocytopenic purpura, malignant rheumatoid arthritis, hypothyroidism, and inoperable cancer. In fact, complications of multiple autoimmune diseases are not uncommon. Also, complications of autoimmune diseases and cancer often occur. But my wife has been taking no medication and has not needed to visit the hospital for more than 6 years. In other words, I could say that all her diseases have already been completely overcome. Needless to say, this is a miracle that cannot be performed by the standard medical care provided in ordinary hospitals, but is not a sudden miracle without clear mechanisms by dangerous and suspicious alternative medicine. It can be explained logically based on legitimate medical concepts. In other words, it's an inevitable phenomenon that can be brought to all patients with clear reproducibility. By the way, those who haven't watched my first video probably felt something strange with my words here. Miracles that cannot be performed by standard medical care provided in ordinary hospitals can be explained based on legitimate medical concepts. What does this mean? Of course, standard medical care is defined by the current medical world as legitimate. In other words, I said that miracles that cannot be caused by legitimate medicine can be explained by legitimate medical concepts. Then the details of this mysterious meaning were mentioned in my first video, so you can see it all in this video, where I will also touch on its outline after this. But anyway, such miracles happened not only to my wife, but also to our friends who fought together in the same clinic. Of course, it happened to many other incurable diseases besides the type of my wife's one. All types of autoimmune diseases, serious cancers, etc. For example, in some cases, tough incurable epilepsy that didn't respond to any medications has been successfully improved in a way that is not found in common sense of clinical medicine. And this recovery for epilepsy occurred in both idiopathic and symptomatic both epilepsy. I'm going to feature these examples in detail next time. And there are also other. There was a case of a young boy who suddenly developed serious memory disorder and was able to recover in an unexpected way. It could only be diagnosed as juvenile amnesia of unknown cause, even at several large public hospitals and even national university hospitals. And it have determined by the clinical medicine that there is no cure for it. In other words, clinical medicine only brought the boy the despair of having to fight against severe memory disorder for the rest of his life. Then finally, that boy and his mother visited my wife's doctor. My wife's doctor never accepts the conclusion that the cause is unknown. That doctor always says the current medical world uses the term unknown causes unexplained too often and too easily. That is never the attitude of a scientist. This is the limit of current medical care that only follows the guideline of clinical medicine. Diagnostic imaging or blood samples taken from one place on the arm is not enough to grasp the detailed condition of the whole body and the roots of diseases. It's impossible to find out the hidden true cause of disease without understanding the functional connections of the whole body based on basic medicine. Then as a result, that doctor found a slight infection of influenza virus remaining on the hippocampus, and with the removal it alone, the boy was easily and completely recovered. Even national university hospitals could not eat, but it recovered very easily. Besides, that doctor's clinic is full of countless miracles. Stopping the worsening of ALS, improvement of clinical depression without any symptomatic medication. Please know it. Many hopeless and incurable diseases that clinical medicine has no curative treatment and only repeats symptomatic treatment blindly have improved in front of me. Then at here, please memorize important points below again. It was not clinical medicine, but basic medicine that brought us such miracles. In basic medicine, especially immunology, provides us with many clues. Then full body maintenance that faithfully follows the concept of immunology has brought us amazing miracles. And what's important at here is this fact. This is an illustration detailed in our first video. I show it again. This is a simple diagram of the world of modern medicine, as shown in this illustration. Actually, modern medicine has three fields in parallel, called clinical medicine, pathology, and basic medicine. Then usually only this clinical medicine is available for patients in hospitals, and pathology is the department that helps clinical medicine by examination, etc. In addition, this basic medicine is only treated as mere academic subjects that medical students study at medical school, and patients usually don't have any opportunity to touch this basic medicine. In other words, this basic medicine is a wonderful science that has clarified in detail the mechanisms of the human body, but for some reason, it's sealed off in the academic field only. And this clinical medicine is not related to basic medicine at all, so it must be understood these two, clinical medicine and basic medicine, are completely different medical concepts. This is not a well-known fact. Normally, everyone thinks that the clinical medicine provided to patients should be built on basic medicine, but not at all. Then why is modern medicine in such a mysterious state? On this matter, please refer to our first video for more information. Anyway, the current state of treatment for incurable diseases in clinical medicine is certainly hopeless. Clinical medicine, which has only the perspective that looks at the human body separately for each organ, and repeating symptomatic treatment blindly without considering the elimination of the cause of the diseases, has no other way but to destroy the patient's body by drugs with strong side effects. No, not only the body, but also the mind is sometimes destroyed. However, from the perspective of immunology, which looks at the entire human body as a mass of connected functions, the cause of the problems of human body was estimated, and once it was carefully removed, various incurable diseases and serious cancers began to recover automatically and unintentionally. This is a fact that should be shared among patients suffering from serious disease around the world. I think so. However, since patients can usually touch clinical medicine only, actually many patients tend to believe that clinical medicine is the whole of modern medicine. Like this, modern medicine equals clinical medicine, including pathology and basic medicine. But this is not correct. Moreover, many people believe that such modern medicine, including basic medicine, is the highest science for mankind and has been standardized for practical use. However, as mentioned above, I must say again and again, certainly basic medicine is a wonderful science that has clarified the mechanisms of the human body in detail. But on the other hand, it's a well-known fact in the medical world. Clinical medicine that was established without rewriting with basic medicine at all cannot cure more than 19% of the existing diseases. And I also mentioned the following in our first video. Once medical students who have studied basic medicine graduate and move on to the field of clinical medicine, there is no longer any problem, even if basic medicine being removed from their memories. As much as that, clinical medicine and basic medicine are unrelated at all. So, in the field of clinical medicine, a mature clinical doctor is finally completed when the contents of basic medicine have been erased from the doctor's memory. In other words, it means that the more experienced clinical doctors are, the more they have forgotten the detailed mechanisms of the human body. Of course, it's not the doctor's fault. Naturally, most doctors sincerely wish to cure their patients. However, it's difficult to say that clinical medicine considers the cure of diseases as its basic policy. So sincere doctors are also suffering from the reality of such clinical medicine. The more ambitious doctors want to cure their patients, the more disappointed they are to face the reality that clinical medicine cannot cure most diseases at all. This is a story we often hear from experienced doctors. Then, what is clinical medicine? If we put the answer simply, it's basically a symptomatic therapy for relieving the patient's pain, inflammation, and other general suffering. It's a medical method that doesn't try to touch the root of the diseases. However, most of the medical scenes featured in TV dramas or documentaries are in the surgical fields. Certainly, many lives have been saved at the scene of injury treatment, surgical operations, and life-saving emergency. In addition, even in the field of internal medicine, only in the antibiotic treatment of infectious diseases with identified pathogens has been achieved complete cures for diseases. Then, since only such dramatic scenes are focused on, we tend to be under the illusion that clinical medicine cures diseases well. However, those are rare exceptions among all cases. Then actually, clinical medicine cannot cure even a mild cold that ends up with a runny nose only. And as mentioned above, it cannot cure more than 19% of existing diseases at all. This is the limit of clinical medicine that clinical medicine itself also acknowledges. In other words, your disease is so severe, it has reached a point where even the greatest wisdom or ultimate technology of mankind are unable to help you. At least, the despair you have been informed by clinical medicine does not mean such unfortunate state at all. Nevertheless, many people accept being incurable or death sentence and give up the complete cure without searching other information. That's because patients overestimate clinical medicine too much. But please remember again, in clinical medicine, the more experienced doctors are, the more they forget about the mechanisms of the human body. By the way, for example, can someone who is not familiar with mechanisms of a PC repair a PC failure? Similarly, people who are not familiar with mechanisms of the human body just have honestly said that it's difficult to repair the human body. The despair informed by hospitals is nothing more than such a thing. Based on the above, then we should find something that is familiar with the mechanisms of the human body. And this is the answer. The field of basic medicine, not clinical medicine, is full of detailed information about the mechanisms of the human body. And if we just carefully read and understand the information that has already been clarified in basic medicine, actually we can find radical cures for most incurable diseases. And as mentioned above, as a result of full body maintenance according to basic medicine, the incurable diseases and cancer on my wife and my wife's friends had gone by themselves. Of course, it's not miracles that happen to a limited kind of diseases only. Various types of terminal cancers, all types of autoimmune diseases, some other mysterious incurable diseases, and even serious mental illnesses really improved, and the cases I saw. My wife's doctor says, the human body is programmed to heal itself if it's not treated incorrectly. The body of many patients clearly taught us it. However, many doctors are bound by the logic of clinical medicine. For example, even if many examples of complete cures of incurable diseases are introduced in detail with evidence, most clinical doctors consider them as impossible phenomena and do not even try to verify them because clinical medicine said so. Then without even verifying unknown phenomena, it's determined to be wrong. It's too stupid as a scientist, and such doctors may be going to hurt the patient's body with symptomatic treatment alone, without understanding the reality and the limitations of clinical medicine forever. Unfortunately, such doctors will soon have no choice but to be replaced by AI. But if they are scientists, at least verification must be done. If it's done, there is no doubt that joy as a doctor and excitement as a scientist are waiting, because patients' happy faces and precious scientific answers are waiting out there. When I heard such doctors' words, I felt that patients also had a role. For example, also in the business market, an industry with many wise customers will mature stably. However, medical science looks like a black box that patients cannot completely understand it. So for example, no matter how dangerous treatment is given, the patient cannot even realize such facts. That's why patients should get the ability to choose our own medical treatment in order to protect our lives and dignity. Then the medical world will naturally have to change. But it's certainly difficult too. So I'm planning to create a video to help patients discuss their treatment options with their doctors. Many incurable diseases and serious cancers could be truly overcome by returning to the concept of basic medicine. I'm gonna try to make videos that will help both doctors and patients understand such examples and its medical mechanisms. Then next time, as the first concrete example, I'm gonna think about incurable epilepsy, the hope for a cure of incurable epilepsy, and how to better consult and suggest treatment plans to doctors. I'm gonna show them. Bringing out the doctor's true abilities is also one of the important abilities of patients. This is called kanjaryoku in Japanese. Kanja means patient and ryoku means ability. So kanjaryoku means patient's ability for fighting against diseases. Then if this kanjaryoku is not enough, the disease may not be overcome even if the patient is blessed with a precious encounter with an excellent doctor. Patients cannot achieve the desired result with passive attitude alone. However, the patient's unreserved active attitude can make doctors unpleasant and put them on the defensive mind state. The doctors and patients should not be in a fighting relationship. Both parties must bring out the best abilities each other to face a common enemy called disease. Based on these factors too, I'm gonna send out information that will further strengthen kanjaryoku. Thank you very much.